Recording.
Wonderful. Good afternoon, everybody. Today is Thursday, September 8th, 2022. And we are here for the Cannabinoid Subcommittee on the Task Force on Cannabis-Derived Intoxicants and Illegal Cannabis. We're going to start with attendance, and then we get to hear some good manufacturing practices presentations today. And then we're going to continue on our conversations that we had from the last meeting. So Amanda, I'll turn it back to you for attendance.
Okay, thank you. Representative Morgan?
I'm present by video.
Senator Hansel?
Present by video.
Rob?
Present by video.
Courtney?
Courtney Moran, present by video.
Matt?
I'm here.
Jay? I'm not seeing him yet. Amanda?
Amanda Metzler, present by video.
Brent said he is going to be running late, probably about half hour late. Andre, I believe, is out of the office today. And Steve Marks is out of the office. So that's it for attendance.
I just showed up.
Oh, you did. Hey, Steve, welcome.
Yeah.
Wait, what's it say? I'm trying to look to. There's no going back. That is for sure. We are ready. Oh, down the rabbit hole. Great. Oh, well, I got stitches on my face today, so you guys get a look at a nice bright bandage instead of the stitches. So fun stuff. And I appreciate everybody that has been emailing and back and forth in the planning for getting the presentations today. As far as the order, is there a particular order that you guys are going? Is it in the order listed, or have you guys discussed who's going first?
I think that the order listed would work really well. The only update is that Dylan got a hold of me a couple hours ago and let me know that he wasn't going to be able to make it. And so he was the last person on the list, so he just won't be here.
That works. So we know that it's important to be looking at everything before we make any recommendations for legislation. And one of the conversations we've been having is what is the role of tracking with the different industries, the different fields of cannabis in Oregon, with the intents of the different ways the plant is used and different stuff. Are we looking at everything? So today we have the opportunity to look at one of the alternates out there, which is the good manufacturing practices. And so Kim Stuck, we have you listed first, followed by Jonathan Staffelt, Phil Swindles. So we'll start with Kim in that presentation, unless Courtney, are you introducing anybody? I see you kind of pop up kind of there, so. Or was Jonathan just taking his camera off?
Oh, Jonathan took his camera off. But the order's totally fine.
That works. I see you, Phil, and Kim, it looked like you were trying to talk, but we weren't hearing you. It gave the purple circle around your initials.
If you can hear me now, I was just going to say that Jonathan and I are kind of one, so I'll be presenting, but we're from the same company and would be presenting the same thing.
How about Kim? Kim, are you there?
Yes, I am. Can you hear me?
We can. Wonderful. Kim, do you have a presentation? Are you?
Oh, so sorry. I was just waiting to make sure I was talking at the right time. I wasn't sure if you were done. Yeah, so I was just kind of asked to talk about GMP in general. And I think that I'm just going to give some overview of what GMP really is and who uses it and why it's important. This is something that my company specializes in. We are, there's a whole hierarchy of GMP, right? So there are accredited certifying bodies, there are accreditators, and then there are consulting firms, and they're all very separate. So like the accreditator, right? Sorry, and I apologize. I have chemo brain today. So if I mispronounce anything or missed something, I apologize. So essentially, like ANSI is a perfect example of an accreditor. And so what they do is they approve standards from accredited certifying bodies. And that is kind of the beginning of how GMP certification is born. Those accredited certifying bodies have to write a set of regulations that are approved by the accreditor in order to run their business. And that also ANSI and there are other ones that exist, but ANSI is just the biggest one that we all know of. When it comes to how their auditors act, what they're certified in, most of them are certified professionals of food safety or certified quality auditors like myself, and make sure that they're running things in an ethical way. Very much the same as a government regulation service. But as we know, government regulators aren't certifiers. This has to be a separate thing from that because the government kind of needs to run their own deal. What we have found, and then there's consulting firms like mine. So you can't be a consulting firm and an accredited certifying body. There's a lot of obvious ethical dilemmas with that. If I create a relationship over a year to help somebody get all the documentation and training and ready to go, of course, I'm going to have a bias. And so we have to have somebody separate come in and do that certification. So this is the way things have run when it comes to GMP for, 100 years or so. BSI is over a 100-year-old company that has been doing this. And this has been used in all kinds of manufacturing facilities, from airplanes to steel making, and also mainly what we're talking about now, wholesale food and product manufacturing, right? So the GMPs that I work with are CFR 111, CFR 117, and CFR 211, which is pharmaceutical, is 211, 111 is supplements, and 117 is food ingredients and food. So right now, there isn't a set standard in the cannabis industry. Each accredited certifying body, we actually work with about 6 of them regularly. Each have their own set of standards that have been approved by, their accreditor. And they're all a little different, but they all have the basic GMP guideline, which is mainly track and trace of all ingredients from beginning to end, process evaluation when it comes to risk management, having documentation and SOPs in place of when things are happening in the facility, sanitation, food safety, HACCP plans, even fire prevention and emergency action plans and things like that. So it is a really, really robust system. And like I said, in regular industries like wholesale food, which is the example that I use the most because I feel like it's tied to the cannabis space the most, this is what you need to have in order to function. So you will not find anything on the shelves in King Soopers or Walmart or on Amazon that doesn't have a GMP certification. They won't buy it from you. So it's almost like the industry set this standard themselves that they should follow this. And in many cases, depending what states you're in and those kinds of things, it is required. And even at what kind of product you're making, because there are different products that have higher risk and less risk. So the difference between, GMP and let's say metric is really only focused on that track and trace of the cannabinoid itself, right? So for THC, it makes sense. You don't want THC to be going out the back door without you knowing about it, right? You want to know when something is harvested, where it ends up, and that it's actually staying in a system, not being sold illegally, those kinds of things. But when it comes to like CBD, for instance, we're less worried about that and more worried about the food safety side of things, track and tracing everything that they're using in a product. So with metric, you're not protected against, let's say, we're making brownies or something like that, and you get flour in from a manufacturer. You put it in your brownies and you send them out. They're happy. You get a warning notice from that flour company that states that, oh gosh, we got peanuts in that flour. That's an allergen that you're not putting on your label and claiming. And so with GMP, you will be able to track and trace everything backwards and forwards and be able to have a recall plan in place so that your entire company is trained to understand what to do during that recall and be able to recall that back. And part of it is reaching out to your local and state health department to let them know that this recall is happening and get their assistance if necessary. When it comes, like I said, I'm a certified professional of food safety. I actually started in the industry as the first public health regulator in the cannabis space in Denver, Colorado. So I essentially wrote the book on food safety and cannabis. There are a lot of nuances with cannabis that exist that do not exist in other industries, as you can imagine. It's very, very different. The regulation is very different. And the food safety and quality assurance side of cannabis in the entire United States is very poorly done. Most state health departments and most state and local health departments just simply don't regulate it at all. So even when there is a problem, a recall never happens. And so our clients that work with us are people who are above and beyond. They're seeing the writing on the wall. They're seeing the risk mitigation of something like this, and are trying to do the right thing. And it's literally the next best thing that you can have other than being regulated by the FDA, because the GMP guidelines that are written by accredited certifying bodies are based on FDA GMPs. So it's not very far off. And if a client has these GMP certification in place, when the FDA does start regulating, they have a lot less to worry about. They're ready to answer those questions. They have the logs in place. Their staff is trained to the point that they understand what they need to do and all of that. So it's been very, very good for the industry thus far. And in the future, I'm seeing this as something that's going to be required and more, just because it'll be an industry demand, if nothing else, for everyone to have. The other thing is that if Oregon requires this instead of something like Metric, because obviously Metric has a lot more expense, long-term expense. To get GMP certification, an accredited certifying body will charge anywhere from $5,000 to $25,000 for that audit to get that certification. So there is, different pricing. To hire a company like myself, it costs around $50,000 to $60,000. That includes all gap analysis, that is every documentation, that's training of staff, that's being there for the audit, and then writing the corrective action plan and making sure that they get that certification. So it's actually, the upfront cost is a lot. So it is something to be, taken into account, but people can do this on their own. We have seen it done. It just takes a little longer. So yeah, is there anything that you guys particularly would like to know about GMP and kind of how it fits in, or how that looks? Because a lot of states such as New York, Michigan, Florida, they require this kind of thing. This is something that, and it takes a lot. The reason that they do it is it takes a lot of the heavy lifting off of the regulatory bodies, because they're putting the onus on the owners to do the right thing rather than just leaving it to chance or having them have to go in all the time to regulate. Because as we all know, in the government, when I was there, bandwidth is a real issue. So Amanda, what can I help you with?
Oh, I was just hoping I could make one clarification before we are done, just so we're all on the same page. We actually do food safety recalls in Oregon.
Yeah.
And so I just wanted to make sure everybody was aware that recall process actually does happen here.
Yeah, no, it's actually one of the greatest things about Oregon is you're one of the only places that actually does that. Yeah, and in Colorado we did as well. I think, when it comes to all of the cannabinoids, if you're having issues or, with food safety, or there's so many recalls, it might be something to either recommend to people at least, if not require them to have it all together. But at the same time, like I said, you have to take all of it into consideration. It is a cost, but requiring something like Metric, there is a really huge cost with that and a big learning curve, not only for the people that have to, put it in place, but also for, all of your regulators as well, and having to know how to do that. I remember when I would do recalls, oh my gosh, back in the day, when I had Metric in place, the system isn't really set up in a way that you can see everything from one spot. So we would have to actually do site visits to each individual place. Let's say I found a concentrate that had myclobutanol in it at very high levels. It came from 7 different grows. So I would have to follow that from the dispensary and then go to the manufacturer that made it and then look through all of their manifests and then go to each and every grow that sent that in order to look in their manifests. So it was a very tricky, time-consuming thing, whereas with GMP, it's a lot easier for regulators. You know, we have FDA regulators come into our clients all the time. Usually we call them to have them come in just to like train them and have them understand what's going on in cannabis and hemp. But you know, when they show up, when it's a GMP process, they're required to keep all of that on their own. And obviously, if they're not keeping it, there are huge penalties and you lose your certification and you have to, you know, all that stuff. So people are really on top of it. You don't have to buy a fancy software. You can do it all in Excel if you need to, just as long as you have a good system that people are actually using. That track and trace is very easy. And you should be able to tell exactly where everything is from one dashboard. All of the softwares that we recommend are actually fairly cost effective. And, you know, it just is kind of up to the operator what they want to do. Representative Morgan?
Thank you, Kim. So one of the things that I heard you say was that Metric is better for tracking THC and not CBD. And when I started down this process with the precursor of House Bill 3000 that led to this task force we're on, it was because we had licensed hemp growers growing THC, high THC products under the hemp license in Oregon. Yes. And so one of the things that has been the biggest concern is that those that are growing hemp are actually growing hemp and low THC. And so for me, I heard you say Metric is the better for tracking the THC. Could you comment on that?
Yeah. So if they're illegally under a hemp license, it wouldn't matter if that makes, let me explain. So if you have a hemp license and I'm very aware of what's going on in Oregon, that's where I live right now and do a lot of work out here. But if you have a field that's licensed as hemp, with GMP, you could, obviously you would have to write into the legislation below the 0.3% and all of that, right? So that you have jurisdiction to go in and penalize someone that is keeping that. With GMP, you would have to have COAs of all of your potency. In fact, you guys could actually say GMP that meets these standards and actually put out, these are the testing standards that we are requiring for your GMP certification. Governments have been doing that forever, and that is completely legit. And then in their GMP, when an auditor would go in, they would make sure that they were testing for all those things. So you could ask at any time for COAs that cover the percentage of THC on every single harvest batch that they do. And that's how a lot of different states are kind of dealing with that. If it's tracking THC and they're, actually growing hemp, then there isn't anything to put into Metric. If they are over a THC amount, then obviously they shouldn't be selling that. So why put it in Metric? At that point, it would be a disposal. And then they should be, logging that disposal, right? Most people, I'm hoping, do. So yeah, and that's the other thing is GMP covers all waste logs, anything that goes in and out, nothing can be, lost, if you will. So it really, and that's the other thing is with GMP, it can cover all different cannabinoids. So you could require this not only for CBD, but any other type of cannabinoid that you want to, Delta 8, Delta 10, THCO, THCA, and all of that, as long as you set the standards of this is the percentage it needs to be below or whatever it may be. And obviously new things are coming out and now they have to be tracked through the THC system, which is great, which I think is a great move. But just saying it doesn't just pertain to CBD. You can make it pertain to CBN, which is also a non-intoxicating cannabinoid. And you would just have to add that to it at any time. Whereas with Metric, you would have to put in CBD, which would be, you could track CBD through it, I believe, if they added that on. And you could also add other cannabinoids as well, but that's all you're tracking. It doesn't actually cut down on any food safety risk to consumers. It really, isn't a robust system for just that. If you're worried about CBD being sold out the back door, then by all means, that might be the best way to do it. Although I don't think that that's happening quite as much as with THC. And, and it's not helping food safety at all. It has nothing to do with food safety. The only thing that it has in it is a testing protocol. And as we all know, the testing system in our country is not exactly the most reliable. So having other things in place will make a much safer product. Sorry, Rusty?
Hello. So my name is Rusty Rock. I'm the Program Area Director for the Oregon Department of Agriculture's Food Safety, Animal Health, and Lab Services program.
Hi.
I just wanted to kind of circle back on where Oregon is as far as our food safety rules and our application of the good manufacturing practices, or GMPs.
Mm-hmm.
At this point in time, all products that are considered to be an edible product or an ingredient that would be going into an edible product is required to be fully compliant with the good manufacturing practices as they're written.
Mm-hmm.
So I just wanted to kind of put that out there. I was a little confused about where we were going with the inclusion of some different molecular derivatives and different substances that aren't inclusive within the good manufacturing practices. Those would require some substantial rulemaking or changes to the laws. So
Yeah.
I just want to put that out there for consideration.
Yeah, I mean, it would. And it sounds like, from what I know of Oregon, any intoxicating cannabinoids now have to fall into those THC licensed businesses. And so they do have to go through kind of a rigorous approval process and all of that. So those maybe be obsolete. All I'm saying is that GMP would cover everything. In fact, we have a couple of GMP accredited certifiers that have just a cannabis general GMP, which covers anything that has cannabis in it. So that also includes vape pens and dabs and tinctures and capsules and all food products and edibles and things like that as well, which is really useful because I think a lot of people in the cannabis industry don't want this to be the tobacco industry. They want to make sure that their products are as safe as they possibly can, even though smoking might not be great for your health. Anyway, it's not as bad as smoking cigarettes and having all those additives and things into it. So yeah, I mean, and I guess I'm not 100% sure about what answers you're trying to find with this. Just because the email that was sent was just like, well, we're kind of deciding if we want to do metric or require GMP. And I wasn't sure if that's true, honestly.
Thanks, Kim. I think that the discussion just has been about tracking in general. And when Courtney connected you with us, she wanted you just to talk more about GMP. So we really appreciate you being able to take the time to talk about the process.
Yeah, and it's a really great process, like I said, and you guys at the ODA, I mean, are awesome. I've worked with you guys many times just on site at some of our clients. Very similar to the way Denver did things, and you are following those really awesome, GMPs. It's more, with the metric track and trace, it sometimes is more of a burden on regulators than it is a blessing, especially when it comes to like non-intoxicating cannabinoids. When it comes to like a field of THC, that really is just going out and testing that product, making sure it's the right amount of THC that is allowed and not allowing people to, sell it anywhere else, which obviously you did a huge crackdown, just a little while ago on all of that. And I think that was a great thing to do. If you're, want more information about GMP and exactly what it covers, like I said, it's fully track and trace, and it includes all ingredients and all of that as well. And could just make even inspections a little easier on everybody because they would have to follow that with not only your regulatory office, but a third party accredited certifying company as well.
Are there any others that would have questions at this time? Kim, are you able to stay on until after the other presentation and let, in case that brings up more questions?
Absolutely.
Wonderful. Then I would suggest, with no questions, we can move on to the next presenter. So Phil, since you and Jonathan are working in tandem, I'm going to turn it over to you for your portion. And thank you so much. If you could introduce yourself, and thank you. Oh, but you are muted.
Thank you. I'm Phil Swindells. I'm the CEO at GVB Biopharma. We're based out in Central Oregon, and we've been manufacturing hemp ingredients for the last 6 years. So, been around for quite some time, and I have a couple of points that I just wanted to touch on. I was kind of taking some notes during the last conversation, so a couple of things I'd touch on there, and then I actually have prepared, if the group is interested, a quick demonstration of our GMP system and like how kind of a recall could work. And I think I could get through it pretty quickly, probably in about like 5 or 7 minutes, perhaps, depending on how many questions there are on it. So maybe a little bit more. So I'll start with some of these things, and then you know, after we get done with that, let me know if you're interested in seeing what our system looks like. We've been GMP certified since 2019, and have, you know, it's a constant system of improvement in your systems, and you know, there's a lot of ways to meet GMP requirements, kind of as Kim was touching on. So the way that I would show is one way that we've decided to meet it, but that's kind of the beauty of GMPs, is that everyone kind of can figure out how to meet the requirements in their own ways, and at whatever cost, however cost effectively they want to be. And you know, the requirements are all the same in terms of food safety and everything, but the way that people can meet them is different and based on kind of their process and things like that. So with that, you know, I think just generally that this whole hemp market is headed to the nutraceutical market. It's likely going to be regulated by the FDA sooner than later. So I think that, you know, making the move towards GMPs would be one step in kind of preparing people for that move. And kind of with that said, just to touch on the metric situation, I think that yeah, as Kim kind of touched on, the metric system, I'm not sure how much that would help with the illegal growing. Only because well, it depends at what point, you know, you would get required to put that in. However, you know, if someone's breaking the law on the front end, you know, the metric system and the way it's kind of designed, or at least the way that my understanding is that it's being presented, is in relation to extracts and kind of downstream processing from the hemp plant. So just something to consider is that, you know, if someone's breaking the law on the front end and the way they're growing it, it would, you know, potentially not capture, I guess, the biggest concern or goal of implementing this process. There's a risk of that, at least, depending on the implementation strategy. And then just generally, you know, the metric process is designed to be locked within the state. And, you know, hemp and specifically CBD are meant for a national market or international market, like us. I mean, we sell our primarily CBD products to all 50 states, and even internationally to the UK, to Europe. And so, you know, designing a system to where now everything is able to go outside of the state and that's going to be a very, very complex task. I think could be a very complex task. Rep Morgan, I don't know if you have any questions or anything specifically on that before I move on to some of the comments about Kim's presentation. Okay. Moving on to some of the comments about Kim's presentation. I definitely would agree with Kim on a few things. The FDA's biggest concern is food safety, both from a preventative measures standpoint, as well as recall product, being able to recall a product efficiently. And that's what they're all the systems that are designed and required for FDA are require us to do. So with that said, so currently, like you mentioned, Kim, a lot of things on the shelf, or almost all food products on the shelf are GMP, depending on how they're produced and how they're sold. But everything from there was a previous meeting with ODA where someone mentioned grain seed is a great example. When that goes to the end consumer, there's a tag on that, and it goes all the way back to the field, through the distributors and everything along the way. So, there's a million ways to meet these requirements, and it's just all about how you think you can meet them most effectively. Just to touch on one thing, which is the cost part of what Kim said, $60,000, that's definitely quite a bit. We have a full-time quality team, so we have 2 people who are on our quality team. They do a lot of additional functions on top of just kind of our GMPs. There's testing related to that, so there is some overlap in terms of normal processes. I think with a metric system, you'd likely need someone who's kind of dedicated to monitoring that, depending on the volume and the interaction level with that. So, there are certainly, it's possible to hire on people who have this kind of experience. Depends probably where you are, what level of person you'd be able to find. But we've got staff full time that are working on this as well as other things at the company, and this allows them to really allows us to really keep the costs down, and kind of do this process a little bit more efficiently. So the CFRs, the way they're written, are pretty straightforward. They're able to be downloaded. Anyone can look at them. You can read them. You can understand them. There are some things in there that take some skill, take some background and knowledge to be able to know what that means. But in general, it's something that's very accessible, and something kind of like we said that's required at the food, nutraceutical, and pharmaceutical levels. So all stuff that I think the state of Oregon would benefit greatly from. And also, like Kim said, there are many other states that are following suit with this. California is one of them. They're requiring a GMP certification. I think that another major point here is that requiring a GMP certification doesn't put a ton of increased cost on the regulation side for the state. If you required a hemp handler to provide a GMP certification, kind of as part of their licensing, it would be a relatively seamless process for the licensing team to just ensure that the documentation is all correct, and then it would be a more simple way of kind of rolling things out, while also being able to achieve the desired track and trace and product recall, which are such key core components of the GMP practices. So, anyone have any questions on that? Any comments? I can give a quick run through of our system if people want to see that.
I see that Rusty asked questions, and I do after he does as well.
Thank you. I just wanted to again bring up the point that oftentimes in the state of Oregon, for general food manufacturing, certification is very common. It isn't something that's mandated by the state in the food industry. It's something that is mandated by the customers. Generally, it's part of the wholesale distribution chain. So if you're going to sell into store Y will say, for you to sell to us, we require that you have a certification of some sort. And generally, those certifications will rely on that base level regulatory requirement that's provided by the state. In the state of Oregon, that would be the food safety program. So we don't really generally interact with the certifying bodies, and we don't in the true food, the conventional food market, we wouldn't take the certifying bodies certificate and say, oh, well, if you have this, then we don't even need to inspect you. That it's layers of those requirements. So the kind of the first hurdle is always the food safety licensing program and those basic good manufacturing requirements that are a baseline between all food manufacturing facilities, whether or not you're certified or not. So I just wanted to kind of put that out there as kind of a comparison between the conventional food market and the edible cannabinoid market, that we try to keep on the same level playing field. Thank you.
Thanks, Rusty. So I worked with a Rocky, so when I see Rusty Rock, I want to say Rocky. So if I mess up, I apologize in advance.
No, Rocky or Dusty, I take all of them.
Nice. So Phil, I guess my question would be, how many organizations out there do the certification process, and where is the accountability through regulators to make sure that it's being followed accurately?
Yeah, so I mean, I think I can talk about the company that we use. We use NSF. I think in general they're probably the gold standard for auditing for GMPs for food and nutraceutical. You see NSF stamps on a lot of products, as well as even appliances and everything. So they certify. They're a really large company. On the spectrum of compliance, we really pride ourselves on being one of the top. So from that perspective, I wouldn't say NSF is one of the cheapest that you could go with from an auditing perspective. I heard Kim mention anywhere from $5,000 to $25,000. I believe our annual cost with NSF is somewhere just under $10,000. But I know for a fact that there are options that are cheaper than that. For us, one of the biggest factors with being able to differentiate and being able to stay around kind of through the tumultuous price market that we've experienced has been that quality standard. So, we really try to hold ourselves to that. I think that our system is our process that we've designed and the systems that we use. Well, our process that we've designed is significantly more complicated. We have really a lot of customers. So, other people may have different systems. They may have a smaller customer base. It may be easier for them to manage. But that's why, again, I'm kind of leaning back in towards our traceability system that we use. That's why we've designed, spent the time to go through and have an electronic system that's very accurate down to the kilogram or container. We can track everything through the process all the way to, this one container in this container with this, lot number from the manufacturer included our product with our C of A, and then trace that all the way back to the vendor that it came from. And then from there, the hemp or, depending on what the product is, all the way through. Yeah, does that answer your question?
Partially, but I see Kim's hand, so I'm thinking she has more to add.
Yeah, so to answer that question, it's really hard to tell how many actual people in the industry have GMP certification at this time, because as Phil said, there are several different accredited certifying bodies, NSF being one of them, one of the ones that we work with. I will tell you that, our company has around 40 clients at all times. I would say about 25 of those clients at any time are working towards GMP certification, just as one of the many certifications that we help companies with. And we have gained 26 new GMP certifications in the CBD and THC industry in the last 4 months. So it is something that is really coming online and is kind of happening. Most of those are in states that it is required.
I can tell you also that a bunch of our, most of our customers, they wouldn't buy from anyone. Most of the, large customers wouldn't buy from anyone who wasn't GMP certified. And so I'm not saying that's, everybody by any means, but it's definitely the way that things are trending. And then to answer, how many people are GMP, well, it depends on your protocols. There's ways to risk out depending on what the product is, but we would go through a very rigorous vendor qualification program for all of our vendors to, check if they have GMP licenses, make sure we keep a copy of that active license on file, and do things along those lines to ensure that our suppliers are reliable, one, that they're, testing things safe. We do testing verification. So when we get a product in, to qualify that vendor or consider them kind of a trusted vendor, we would test their products at random intervals until, ensuring that our COAs line up with the COAs that they're providing us. So, I mean, there's a lot of, specific protocols and documentation that go into all of this.
So as far as you mentioned that NSF is the gold standard of GMP certifications. Who sets that standard? If it's not known how many people provide GMP standards, how do you know there's actually a standard being met?
So that comes back to the entire accredited agency. So we work with 6 accredited certifying bodies who have written regulations that are GMP regulations based off the FDA's regulations. They are all a little different, as Phil said. I mean, NSF does have a very high standard, but so does BSI and Perry Johnson and most of the ones that we work with. They are accredited through ANSI or like ASQ or something like that. So they have the checks and balances in place, these overseers, if you will, to make sure that their standard is up to par and doesn't change and doesn't have huge loopholes or holes in the system, to make sure that it is as safe as it possibly can be. And also the way that they run their company is accredited as well. So everything to do with the people that they hire, the auditors, making sure that they have the right certifications and those kinds of things are trained correctly. And then those auditors within the company are also, they do like ride-alongs with them and then evaluate if those, if they're morally sound and ethically sound, and making sure that they're making the right decisions and not, taking cash or, doing anything really weird. So that's what the checks and balances thing is. So there are several different accredited certifying bodies. They all have to answer to the same accreditation agencies, if that makes sense. And ANSI, I mean, if you look on any airplane, ANSI is stamped all over it. I mean, they do everything from steel to concrete to airplanes to, all food safety and that OSHA stuff. And so they're really they're really used to that. They've been around for hundreds of years, essentially. And so some of these accredited certifying bodies, I mean, BSI has been around for over 100 years, and they've been doing this for a very long time. And it is very, very hard to be accredited and to, maintain that. It's a lot of paperwork and all of that. So like I said, the wholesale food industry has been doing this and using these standards for a really, really long time, and it's been really beneficial to the industry.
I know that task force members, subcommittee members know they can raise their hand at any time for questions, but I'm going to throw it out there. In the meantime, Rusty, I have a question for you from ODA perspective. How many, does ODA monitor how many hemp licensees in Oregon have or meet this GMP standard?
So yes, we do license any firms that we're aware of that are making food or food ingredients. As part of that licensing process, they would have to meet the good manufacturing standards under 117. We don't operate under the pharmaceutical rules. So earlier, Kim had talked about 21 CFR 211 and 21 CFR 111, which are the food supplements, which is 111, and then the pharmaceuticals, which are 211. Those are a whole different ball of wax. So I can't speak to those regulatory standards because that's a whole kind of escalated level of control. So those generally, when people talk about them, they're talking about like the CGMPs or the pharmaceutical CMPs or GMPs. So those aren't something I can talk to. But as far as meeting the food good manufacturing standards, we do track that very carefully, and that applies to both the hemp manufacturers and the cannabinoid, the marijuana processors as well that are making food and food ingredients.
So Rusty, I think what she's asking is not your standard that you regulate to, that's a great standard. I think what she's asking is how many actually have a third party certification that you know of. And if you track that, I'm sorry.
We definitely do not track that. I appreciate you clarifying that for me. That is not something that we monitor or track either in the cannabis industry or in the food industry.
I appreciate that. Are there any other questions? Rusty, is there anything you would like to add? I appreciate you being here today and available for questions as well. And I guess I would ask from the standard of ODA, that is the licensing entity over hemp in Oregon. So we were going to be looking at the track and trace systems needed for imports, exports, wholesale, bulk cannabinoids, hemp materials. Some of the things in the agenda coming up. I'm wondering if you would weigh in on any of that from agency perspective.
So I would need to defer to Sunny Summers on those areas. The areas that I'm more familiar with are the food safety aspects of the hemp products, as far as the tracking in the fields and some of the agricultural side of it. I'm more on the food manufacturing side, so we don't have any tracking or tracing that is built in as a requirement under our system. If we were to find there was a situation where a product would be considered to be adulterated, then we would rely on the manufacturer, and if they didn't have any way to bracket where the adulteration occurred, we would remove everything from the marketplace that was associated with the brand. So that's kind of our response plan, but Sunny would probably be able to speak better to the tracking traceability side.
And we have been talking in this group as well about the need of maybe a QR code or something that kind of tracks it back to the source, no matter where the product ends up, essentially. So any consumer can scan that QR code and know exactly where their cannabis product originated or in that process back. So currently there isn't anything that you're aware of in the ODA doing anything like that.
No, not in any food commodity that is sold within the state of Oregon. I don't believe there's any traceability that is that robust.
Yeah, and that sometimes is something, there are a lot of companies that do that for GMP. So we have a lot, I would say most of our clients do a QR code for that exact reason, because if they buy a software system that has a really good track and trace, and there is a bunch of different software systems, but like Kanha, excuse me, one of them that we use the most, they have that QR code feature. And I think, now that technology is getting more advanced, that's more of something that a lot of our clients are doing, because it does make it a lot easier.
What we found is the handoff between the different levels of manufacturing tends to be where the traceability can break. Most of the requirement for under the 21 CFR 117 food manufacturing rules is you have to be able to trace one step past your distribution and one step prior to your supplier. So that's the standard that we tend to hold our manufacturing firms to, is be able to trace who you ship to and who you received from. And then you have to rely on your vendors at that point. So that's where that certification comes into play, when a lot of the manufacturers will require that their supplier prove to them that they have enough traceability to mitigate that exposure to their upstream producers that they don't have direct contact with.
Any other questions from any of the task force members? All right, well, I certainly want to thank Kim and Phil and Rusty, but I realized I missed Kara, who's on the list to do a presentation, but she's not here today. Okay, so not just Dylan.
Kara was my employee that was going to fill in for me if I was feeling poorly, but I actually felt really good today, so I was happy to be on. So thank you for allowing that.
Well, thank you for being willing to be here, even with having health issues going on right now. So our prayers for your health returning soon. And
thank you.
Absolutely. All right. So I appreciate the presentations, or just the availability of information. Those of you that presented, I would, as we continue on this conversation, if there's questions that come from it that you might answer, if you're able to hang in there. If you're not, I understand that as well. Rusty, since you got the initials after your name, I'm going to say you're stuck with us. No, I'm just kidding. If you have to go, I understand that too. So going on back to the stuff that was continued from last meeting, if there are necessary changes to state law that we would recommend, where do we start from there? So I'm going to open it up to the task force members. Do you have thoughts on, is there a type of track and trace system needed? We asked the question when it comes to bulk cannabinoid hemp, and also batches and labeling, test results and such. So where do we go from here? I'm so glad everybody jumped at once.
So Morgan, I do want to say, despite my initials, I do have to jump out at 4. So I apologize for having to bail, but I do have to jump. I've got another meeting I have to run to.
Rusty, thank you so much for being
here. To get a hold of me, and I'm happy to answer any questions remotely after the fact if need be.
And Sunny does a great job of representing ODA here as well. So I appreciate you bringing the food perspective in today. So thank you for being here.
All right, thank you.
Rep. Morgan, I can answer your first question very easily, and that is yes, I think we do need something. Your second question, what should it be? That gets real challenging.
I agree,
which I
Senator.
realize is the one that we need to answer here.
I think certainly as stuff for going to grocery, the GMP kind of thing makes sense for food related things at a national standard, but we still are dealing with a lot of illicit marketing and drug trafficking organizations doing things throughout Oregon that really put the whole industry at risk, unfortunately, where the goal is to not over-regulate to the point that our licensees are not able to be in the business. But at the same time, some of the products that are being produced through these organizations are, well, I'll just be blunt. We recently had a presentation locally here from our solid waste employee that we have people in my community getting chemical burns from the runoff of the cannabis grows up the hill and local swim holes. And imagine if they're causing chemical burns on your skin while you're swimming in the waterways. What is that doing to somebody that's consuming that product? Because they're selling them through other means, and it's undermining anything that would say this is licensed Oregon cannabis. And so if it can burn your skin while you're swimming, it's certainly not good on your insides. And that is still something that has not necessarily been addressed. And so where I can appreciate that if our system were pure, and that's what our licensees are trying to do. So how do we have a system that, I mean, this started with people using hemp licenses as the loophole for growing THC outside of OLCC. That's where, when I came in with my first legislative concept, that's what we were trying to deal with. Now we've seen a level of enforcement added through ODA and OLCC working together in the last 2 summers now, last summer and fall, and so far this year, to crack down on a lot of that. And we've seen a lot less applicants for licenses in the hemp system. So is it still continue to be an issue under a hemp license, or do we do we still have to be mindful of having those regulations in place so somebody doesn't still skirt the system? I guess is where I'm coming from, is wanting to have something that works for our hemp licensees to be part of the national program as legalization and the trades are coming. But because of where we're at and the systems that are all separated, different agencies monitoring different agencies, I guess that's still where we kind of get down to, how do we hold accountable those that are growing illegally? So Courtney, go ahead, please.
Yeah, thanks, Rep. Morgan, for recapping, where we come from and what we're still facing today. I look at the subject matter of what you just mentioned as 2 different conversations, right? One is what's happening on the ground in the field versus what is happening in the manufacturing facilities, what products are being made and what are going to consumers. And so the issues that are happening on the ground, a lot of that's what we're discussing in the law enforcement subcommittee. A lot of it, from what I hear from Sheriff Sickler and from others on the grounds, a lot of it has been handled within the hemp program itself. What's happening outside the hemp program, that's something that we're working on, and that's some of the recommendations that are being made regarding amending search warrant authority and execution of search warrants and jurisdiction for judges issuing search warrants and things like that we're handling in that law enforcement subcommittee. But for this subcommittee on cannabinoids, I see our role more focused on what's happening in that manufacturing facility and the products actually going to consumers. And so to bring it back to the conversations from today and the presentations that we heard on Metric a couple weeks ago, and then the GMP presentations today, and what I'm hearing from the hemp industry, not only in Oregon, but nationally, is the desire to move to that GMP standard. And so, I mean, the reluctance I've heard from companies is the cost. But if companies are going to be required to implement a system, they want it to be a system that is going to reflect national standards, not something that's only going to be reflecting the Oregon marijuana program, right? We want to be looking to what are those national standards? What is the international community looking to? What will happen if and when FDA starts regulating these products? And so that's why, I wanted to make sure that this subcommittee had the presentations on GMP so we could learn about what companies are already doing and how those measures do contribute to public safety, which is what I understand is our main goal with this subcommittee.
I appreciate that, Courtney. I would maybe add, though, that whether it was grown legally or illegally, it's still consumed by somebody. You don't grow cannabis to not have a consumer. And so how do we, in the tracking and tracing that was passed under House Bill 3000, make sure that we follow up? And I appreciate hearing that metric may not be the best thing for the overall recall and food portion. However, there's still, I don't know, I like what Kim provided that said, you put in some GMP standards that put the, let's see, the COAs of potency, as she said, and under the 0.3 THC under that standard. But if, I guess it's just a different way of thinking about things. Does ODA monitor if somebody has the ANSI standard, if they're certified through that, if they are not, there's a level of regulating the regulators in that process. And it's more than just food. And the problem is that under hemp licensees, it wasn't hemp that was being produced. And so there's still a process. I still have people in my community that are, they're weekly, there's busts going on locally. And there's many that last year weren't quite in compliance in this area. So trying to find a way of encouraging hemp licensees to follow the hemp guidelines and make sure that that's safe, but also holding accountable those that are skirting the system of not being in the OLCC system. Kim, go ahead.
Yeah, I'm so sorry. Just for some clarity. So when it comes to cultivation, that's more of a GACP standard. GMP doesn't, it backs up to cultivation. So from when it's harvested and you have flower and it's sent into a manufacturing facility, that's when GMP starts. But in that GMP standard, they have to test everything that comes through the door and that they use in their product. So they have to test that flower, even if it's already been previously tested by the grower. And so I think with the issue that you're talking about, of like people getting hemp licenses and then saying, you know, growing marijuana and then selling it as, you know, something else, and you're not tracking that. I think at least this is what I've seen in other states, is having a program where before they can harvest anything in a licensed hemp, on a licensed hemp farm, a officer goes out and does their own sampling and their own testing. And once that testing is passed below the percentage of THC that is okay, then they are allowed to harvest that crop. And we've seen really good results with that. It does take some manpower though. That's the only problem, is to have someone go out and actually sample those fields themselves. I mean, I've done that when I've done recall of investigations myself many, many times. And it is something that is a bit of a process, but we have seen really good results with that. And then once it's packaged and then sent to the manufacturer, they would test it again, and they aren't allowed to use that product unless that COA says it's below that THC as well. And so it really prevents it, because nobody wants to buy product if it's not going to pass after they buy it. So it kind of puts this stress on the manufacturer to really be in compliant and vet their vendors, right? They're not going to buy from non-legit grows because it will affect them in their manufacturing process. Oh, and just a quick, I'm so sorry. Oh my gosh, I'm so sorry. But what I'm saying, so with GMP, it is written into those GMPs that any state standard for testing is what they have to follow in order to be GMP certified. So if you guys implement, these are the testing standards that we have, everything has to have COAs to be used in this product, then for them to get GMP certification, they would have to meet those testing standards of the state that they're in. Just a heads up. So putting anything in place automatically makes it so that they have to pass those standards to get GMP certification, just for clarity.
I appreciate that. Thank you. Courtney, I saw your hand go up and down. Just want to make sure that covered what you were wanting.
Yeah, I mean, I'm trying to brainstorm over here because it's what I'm thinking is, I mean, there's one avenue of the folks who are trying to comply. They already have their handler license. The folks that will have to get the new handler license once the new ODA rules go into effect for the 2023 production season, and they'll have to follow these requirements, right? But then there's these other folks that you're talking about who aren't trying to comply at all. They're violating our program. They're not following these protocols. So maybe it's some sort of enforcement piece or, civil penalty or whatever type of penalty for someone that is not only not getting the right license, but then not following whatever protocols we put in place here.
Well, I think for me, it comes down to ODA is, I mean, we testified, or I testified last year to try to get more funding for more folks. One of the questions we look at is the capacity of the agencies to handle more. So how much more would be required of an agency to add in that every licensee would have to meet the GAC and GMP standards that are and accredited standards rather. It sounds like that's the minimum that you would accept, that they have to be accredited. And how many companies meet that standard? So right now with track and trace through metric, there's one company approved for tracking and tracing. If it goes out to an RFP, and another company maybe got the bid for the state, there's still, for the medical and for the OLCC system, there's one track process right now. So if the GMP standard or GAC standard, as we heard today, there could be any company doing it. And as far as making sure that there's a standard in Oregon of what that is that good enough? So,
and you can certainly choose. So like in Maryland, just as an example, they've said, okay, you can only use Perry Johnson, BSI, NSF, and SGS, because there's a lot, honestly, of accredited certifying bodies, but most accredited certifying bodies will not work in the cannabis industry. You have about 8 to choose from. So really, I mean, you can choose whichever ones you want to use, just so you know. And that's fine. I mean, a lot of states have done that. They're like, hey, this is the standard. This is the certifying company that we want you guys to get it through. And, and that's it.
So when I go back to our agenda and looking at the 3 bullet points we haven't really addressed, whether the track and trace system is needed. We heard that Senator Hansel, yes, we do want a track and trace system. But for each of those, whether it be the batches and labels or the bulk cannabinoid hemp materials, the 3rd bullet point is for each of these, should it be a single source of maintaining data like CTS, or would GMP or GMP like, or as we just heard, GAC standard be adequate? And if the business is not keeping adequately traceable records, like, is an Excel spreadsheet enough that could be deleted and not be kept? What is the minimum? Should it have to be uploaded into a system and reported on for accountability beyond just that accreditation process? Go ahead, Senator.
Well, it seems to me, and I don't want to put Steve on the spot, but they've got tracking, they've got ways to make sure that what's done, on the alcohol side of stuff, that, I mean, do we need to reinvent? I mean, I'm just, or maybe they don't, but I know that, when product goes out, there has to be a accredited, I mean, it's the sales and stuff are monitored. Steve, do you have any suggestions to us at all?
Well, I still think it's probably a derivative of what we do off metric. One of the things that we did with outdoor bulk grows, we did, harvest notification. So we could check on compliance when they're harvesting. Now, different beast, right? But you kind of want to stop the movement of hemp products that can be converted to intoxicants, right? Oils, bulk products, go to another state, be remanufactured, whatever. So I think you want to know two things. You want to know how much you want to know it's grown in the field where it says it is, and it's still there until you say you're moving it, whether you've harvested it and you're taking it somewhere else. And then you want to know when it's harvested. And I don't really like the in the field plant test. That is the tenet of the program for hemp, but that's what they use, is that in the field final test. But if we had final product testing and test it out, then ship it to where you want to go. Those are two reports, a couple of reports in the metric system. As you move upstream to how do these certification standards mesh up with what you might require in a track and trace system, it's really about, did the record from the lab attach to the package that it went in? Does it have the right warnings on it? And then did it go from the manufacturer, the final product, the packaged product, did it go to the right retail, and can retail tell it? Is it distinguishing enough? Because I think our real issue isn't just, is it hemp? It's, is it distinguishable from intoxicating cannabis? And that's an important feature that we got to build here, is that wall between them. One is taxed, one is not. So I think there are things in utilizing metric or a track and trace system that emulates what metric does, from bulk farming product to bulk commodity to manufactured item. And in the cannabis space, for instance, I'm adherent to the idea that we should have a national registry for every single product made, right, across the country that meets the standards. You could have the QR code, you could see it. Hemp products could be no different. That would give consumers great credibility. But the details of what we want to look at, to me, the GMP is data that can be plugged in for what we want as a state to know, and we want consumers to know for sure. Now, there are ways for companies that individually, you can track back and you can work through the company based on standards and accreditation. Certainly can do that. But that's the difference between having an explicit state track and trace where you're looking at everything along the way, and sort of what I think is a bit retroactive system where you have accountability as you move backwards, as you have a product problem in the marketplace, and you move back into an individual company and into an individual company's records and into who they said they used, and then the fields that it came from. So one's more, I think, what we're looking for, some a bit more ubiquitous than just the standards alone that they're meeting out there for producing, quality products. And these companies are heavily invested in. As you heard, $40,000, $50,000 is not an insubstantial sum of money.
Yeah, and I agree with Mr. Hansel on, we don't need to reinvent the wheel. And if you feel like an Excel spreadsheet is not good enough, even if they're passing the GMP, the accredited GMP audits, they're okay with that. But like I said, as a state, you can write whatever law or regulation you want, and because it's a regulation in that state, GMP has to follow that, right? And take that into account. So if you wanted to say needs a software program for track and trace, that would allow people to choose whichever one, because there are some really great ones that are much more focused on GMP and will track everything instead of just CBD or THC. And that, for a food safety and GMP standpoint, is what works and what is required. And I would say that 90% of our clients have a software in place. We have several softwares that we work with that are smaller and cheaper, that work just as well as the ones that are made for Fortune 500 companies that are very expensive. And so you know, with that, they wouldn't have to tag everything and, you know, everything like they do in Metric. It would be less costly than that. That's for sure. In fact, I've had a lot of our THC clients go, God, I wish we could just use this software and that was it. But because if they want GMP, they have to do both Metric and the software to be GMP certified, because Metric doesn't meet the standard that is required for GMP because it's not as robust as it should be.
So Morgan, I guess I have having just heard that, the question I have is then, well, if we've already got softwares that'll work, and there's, you know, half a dozen, 8 out there, how do we go about accessing that and making a decision that on our selection, if this is the direction we want to go? We got to tie it in. Works.
Yeah, Senator, I hear you there. I think I would pick on Sunny and Amanda maybe and say, can we find out what states have the cannabis hemp programs going with the GMP standards? Which companies, how did they pick which companies they did? Is there, so we're not reinventing the wheel? And I guess maybe see if we can have you guys report back on why did these 4 meet the criteria in this state and these other 4 did not if there's only 8? Or what are the minimum standards that we would accept out of a company to meet what our needs are in Oregon to fully be able to track and trace all portions of it? And
so from what I've seen in other states, it's the software has to meet the standard of GMP, and that's all the state cares about. Really, they just kind of make a blanket statement of you need some kind of soft track and trace software in place that meets the GMP standard. And like I said, then it kind of opens it up so that they can choose whatever. They're not choosing these are the 3 softwares you have to use. That I have not seen. It's really
no, but
just
didn't you say that there were maybe only 8 people that do the GMP or cannabis, and there was some states that say you can only use these 4 companies?
Yeah, the accredited certifying bodies. Yeah,
correct. That's what I'm talking about.
I thought we were on software, so I apologize.
No, I can care less about the software. Okay. I care about it meeting actual. I guess for me, I come out of the world of I was a 911 dispatcher and, you know, criminal justice person. So I had the Department of Public Safety standards and training, and anybody who was certified as a dispatcher or parole and probation or sheriffs or corrections deputy, you all meet the same standard of minimum level. And so I'm a standards person. And so what are the standards out there of these companies that those are the 4 companies that were approved for agencies to have the accreditation through, I guess would be what I'd be curious on. Amanda, go ahead.
I just 2 questions, one about the software and one about the cost. So the question about the software is currently with Metric, with the system we use for marijuana tracking, the state can see where all products are at all times within the system up until sale to a consumer. And even though we've been talking about how it can't really do recalls, as we mentioned earlier, it's very fully capable of doing recalls. We do them all the time for things like peanut allergies to pesticides, right? It's totally doable. So my question about that is, with these software providers that work with the GMP process, would the state have eyes on that data? Would be my first question. And then my second question is about cost. Currently, with our contract, we have a Metric account costs about $40 per month, which is $480 per year. To me, $480 seems much more cost effective than $10,000 to $60,000 a year. And so I'm wondering about small businesses, especially businesses that may be like a mom and pop. They may be just making, you know, some edibles that they're selling at, you know, Saturday markets or something like that. Are we going to price them out of the market with something like this? I think that would be my main question.
I think that if Metric now has the capabilities to track and trace everything throughout the system, then it would meet the standard of GMP. And maybe we need to have you talk to somebody who is an accredited certifying company to verify that. Because if that is the case, which I haven't seen that and at all, or so, but obviously things change, and that's awesome if it has, because if Metric can actually trace everything that is required for GMP, then that might be the best way to go.
Yeah, go ahead, Senator.
I think too that it's really important, and I kind of alluded to that before, is that we work closely with OLCC to get whatever we are going to recommend, that they're able to use it, or because I think it's going to fall under their purview at the end of the day, and they're going to have something. And I would incline, rather than us choosing something or try to figure it out, have OLCC come up with what they think is needed and how to work it. And we could back it. I mean, I may be barking up the wrong tree, but that's kind of where I liked what Steve had said earlier about what we need to do and stuff. Well, if that's the answer, let's find the software and stuff and finance it and get it to them to do that.
So, Senator, I'll just note that Representative Marsh tasked us to get together with ODA on track and trace and take a look at those issues from what we could do. So we are going to do that work with ODA and hopefully report to you later in the fall about, what features might be workable, how you might use them out of Metric, what might be the unique incidence of reporting we'd want in the Metric from the hemp side. And testing. So I think we would look at those. Obviously, there's a lot of big different ways to do levels of doing that track and trace, right? And we want to make it affordable. We want to make it commercially viable for companies to be involved with. And we want to have enough accountability in it to know, I think, not what the illegal products are doing, but the products that run through our system, we have a high degree of certainty for the consumers about those products being reliable and the standards the products were created under and how they've been, brought to market and presented to the consumers. So yes, I think that's, we would do that work in conjunction with ODA and really try to look at how to do this both, I think, on two sides. One is that bulk side tracking, how to make that easy as possible, right? Simplest reporting you can do in a couple fronts. To have it on the packaging, the product manufacturing side, I can tell you, you're almost above my pay grade when I'm thinking about all that stuff being plugged together there. But the features within the metric system rely on the kinds of data, right? Not maybe all data points from what you would do for a GMP process, right? Ingredients that go in, what you know about all testing, put a QR code on it, give the consumer someplace to go to look at all the detail on what went into that packaging together. We don't actually have required QR codes yet on our cannabis products, and so our marijuana products in our system. We're looking, so with Metric, we're just to this status view, we're moving current rulemaking to get rid of plant tags. We're going to a batch level for the cannabis plants, for the marijuana plants. That translates well for hemp in a way that we're going away from that. We are then working on this process of what do we dovetail together with cannabis overall and tracking with Metric. How do we track hemp with it in a way? And then we're currently also looking at our future requirements when our contract comes due with Metric in September 2025, what we would lay into a more, both user-friendly and consumer-friendly product. What do our constituencies that are going to be a part of Metric want it to do for them? A big part of that work has been and I hear this on the cannabis side all the time, right? Tying it together with major manufacturer software that is out in the marketplace. Now it does tie together, but a lot of that can be data dumped then into Metric, right? It can happen more automatically. But Metric has to invest in those features, and we got to be able to give the major manufacturers of other software that are being utilized the opportunity to they get through on an API, but we've also, I think, looking at some app-based software to integrate with other applications. So that would be helpful to our work, helpful to not getting redundant costs onto producers and manufacturers out there. But little short-term and long-term story there. So you got to decide, I think, what level you want to put hemp in at to get some traceability, and then what do we want more or less, just to make sure we're at the top notch on what the country is going to require of cannabis markets nationally.
And thank you for reminding me that ODA has the hemp regulations too. I'm so wrapped up in the illegal hemp thing, trying to get that. I forgot about that. So thank you for that reminder. Appreciate it.
Kim, go ahead.
And I'll just piggyback on Mark Stevens' point is, I think a lot of states that are requiring GMP nowadays are also wanting to help their companies last when the FDA starts coming in. And I will tell you that in a lot of states, that's what's going to happen. The FDA is going to come in and a lot of them are going to be put out of business because they aren't meeting the standards of the FDA. And so thankfully, the health department in Oregon has, pretty legit standards. So I think most of them would do fairly well. But having that GMP certification, if an FDA agent walks in and they say, we are certified through these people, here's our certification, it's a quick, easy walkthrough type audit. Because they know that there is a third party that is auditing them every year along with their health department. So they're really regulated, and the FDA doesn't have a lot of time and a lot of bandwidth. So, a lot of those times, it makes it a lot easier on the companies is all I'm saying. And having them ready for that and understanding all the things that they need to do is setting them up for long-term success, which I think is something that Oregon has always done very well for the people that live here.
Matt, please.
Yeah, listening to all the discussion, it kind of, certainly Metric has its pros and cons as far as tracking, but it sounds like GMP not only does complete tracking, but also ensures consumer safety. So maybe we need to focus on the consumer end. People who are going to do stuff illegally are going to do stuff illegally, and you got to catch them. I mean, all the rules and regulations you can put in place aren't going to help it if they're not willing to follow any of the rules. But it comes to my mind that maybe, from a cannabis in general, both hemp, marijuana, everything, that we take a look at requiring a GMP certification for every consumable cannabis product in the state of Oregon, whether it be marijuana or hemp or whatever, kind of be a broader, more encompassing process.
It certainly would be interesting. I mean, considering we've had OLCC folks say that Metric is expensive buying the individual tags, and if there's a way of tracking, I mean, there's still a cost perspective. When I hear 50 to 60,000, like Amanda brought up, that's disconcerting that a business would have that high of an expense, because I don't think they have that much of an expense to the Metric program.
Right. But
So-
that is for somebody who doesn't have anything in place. They don't have one SOP in place, and it takes about 6 months to get through the process. After that, they don't ever pay that again. So then after that, once everything is in place, and that's only if they hire a consultant. This is all things that people can do on their own. It's just if, we work as a consulting firm, and I just wanted to throw out, like, if they need to hire a consultant because they do not have the expertise, or for some reason they just want to outsource this because they're busy, that's what it would cost for a consultant. So that is not the cost of getting GMP certification. So the GMP certification, like I said, we've seen companies that are, $5,000 to $25,000, and I've seen NSF at $25,000, but that was because they didn't have an inspector or an auditor in that area, and so they had to fly someone there, and they ended up having to stay there for 4 days because it was like a huge facility. Everything goes into that cost. So when I said that, I didn't mean to throw anybody off. I was just trying to show like what some people have paid because they didn't have the means to understand GMP. But the regulations, when you sign up with an accredited certifying body, they give that set of regulations to you. So if you have someone on your staff that is very good at reading regulations and has a food safety background or whatever, then they can implement it themselves. But it does take a lot longer usually. And in most states, such as New York is a good example, where they have their accredited certifying bodies that they have chosen to be, these are the okayed ones, and not, they are requiring it be ready in 6 months. And you lose your license if you don't have GMP within 6 months of getting your provisional license. So that's why I was throwing that out there, was just so that you know that some people have paid that much, but most people, it's actually like $5,000 to $15,000.
I'm going to jump to Director Marks and then Brent.
Thanks, because I wanted to ask Kim a question. So Kim, just help me out, because I'm not sure I understand it. Is that you get the accreditation that you're able to manage at this level and standard? Is that, but do you need that for each different type of product that you're gonna manufacture as a consumable? And then second question, if that's the first side. Second question is, we went through that CBN debate, right? It's non-intoxicating, minor cannabinoid, helps with sleep, but we said, you needed to have a GROS-like standard, generally safe, right?
Mm-hmm.
And those studies, I understand, for the companies that may be doing that for their product, that's only good for their product, the CBN that goes in their product for that thing, not all CBN generally in the marketplace. So can you help me fix those two things?
Yeah. So getting GROS is very, very expensive and very, very hard. And you're exactly right. If you get a GROS certification for the CBN that you're making in your facility, that is the only CBN that it covers. It's not all CBN in the world. So I actually don't think that that's the best route to go because of that huge cost and time. It takes a couple years. Sometimes it's $1 million. I'm not going to lie. It's insane. With the GMP, what you're talking about is, what does that cover? Different accredited certifying bodies cover different things. NSF covers only consumable products that are orally consumed, right? So if they're making vape pens and things like that, those will not be covered under the GMP, but they'll be made in a GMP certified facility because it's the actual location that's certified, not individual products. Like you can't put a GMP sticker on a product. It can be on your website. It can be, in your dispensary, that kind of thing, but you can't put it on your actual product because of this. There are standards like Perry Johnson, which is a very reputable standard. They were one of the first GMP companies to get into the cannabis industry, which is why we work with them. We worked with them probably more than anyone else. We actually helped develop their cannabis specific standard because they needed GMP experts to help them with all the processes and stuff, because not everybody knows, extraction without knowing it. And so their GMP standard, and they are an accredited certifying body and have been for a really long time. They cover all cannabis products that are made in that facility, including all the vape pens. So those vape pens and pre-rolls and all of that are to GMP food standards as well, which I think is really cool, but it just depends on what the company wants to go with. It's really up to them, at least with our clients, which accredited certifying body is. And when we, bring on a client, we explain all the differences and the differences in pricing. And, only 2 or 3 of those companies will work in THC facilities. So we have to kind of narrow down which ones will work best for what they're making and what products. If we're in a facility that only makes edibles, then NSF is a good one to go with. But NSF also only covers hemp. They won't do THC. So if we have a THC client, we have to find, so it is a little convoluted, if you will, but there are, the standards cover all health and safety. It's just a matter of what that company is capable of doing from their, corporate board standpoint.
Can I just follow that up? It's very helpful. Thank you. So like CBN, how do they know in a GPM program where to put it or how to consider it when that's what we couldn't tell? What standard, relatively new, at least mass-produced product in the marketplace, right? It's always been, degradation of marijuana and smokable leaf, right? You get when you do it. But now we're seeing it produce more quantities going into human consumption. No real great science around that one. I'm just using that cannabinoid as an example, and forget synthetics. Just think about all these other great cannabinoids that they're going to come forward with and load up into products potentially. Somewhere you got to get the standard set in some way. You got to know what it is. And I don't know what the default is. It's your methodology. At least in GMP what you did and what you put into it and how that relates, or do you meet a particular standard for all those folks, or do they have a particular standard by cannabinoids?
Yeah, so that is why Perry Johnson built the cannabis standard in general. Anything that comes from a cannabis plant that you are making in your facility, that is what is covered. So the reason they did that was so that these different companies, because there's going to be a different 10 cannabinoids every few years. I mean, they did not just legalize a THC plant. They legalized hundreds and hundreds of different cannabinoids. And then on top of that, all of the derivatives that are coming from those cannabinoids that are being made in a lab. And so Perry Johnson wanted to make sure that companies, even if they're, making these new products, are making them as safe as possible from a food safety standpoint. And we're able to do that because, as we know, for a long time, CBD and THC, these certifications weren't allowed. They weren't even given until like 2018, which is insane to me and a little scary. But they wanted to open that up to any new cannabinoid that is either discovered or synthetically manufactured. In fact, we have 2 Delta 8 clients that we work with in states where it is legal. And then Perry Johnson is going to give them a GMP certification. So, I mean, it just kind of depends on it. Like I said, what certified body is, what they want to do, what they feel is right, and what is, the least amount or most amount of risk that they're willing to take. I think what they're doing is amazing. I think that it should be that way because that should be an option because these cannabinoids are going to exist anyway. And being able to have those cannabinoids available from a GMP facility lets consumers have the power to choose, am I going to pick the one that's GMP and, one that I at least trust enough, more, even if we don't know a lot about the actual cannabinoid itself, because that kind of testing and data is far away, unfortunately. Or am I just going to roll the dice and buy this stuff at a gas station? God only knows what's in it, you know, and I think that I would say most consumers would choose that GMP certified facility. And that's kind of what Perry Johnson was thinking was, you know, we need to give consumers the right and to buy good products, regardless of what is in them. So if it comes from a cannabis plant and like I said, they also follow state regulations. So they would not, if they had a Delta 8 company in Colorado, for instance, where it's banned, they want a GMP, they would say, no, it's not legal there. You have to still follow your state regulations. We check that you're following your state regulations. And then you also have to comply with the GMPs that are in place for our standard, if that makes sense.
Thank you.
Brent, go ahead.
Yeah, thanks. It's a lot of information. Been great to kind of hear thoughts around the certification. I think one important thing to note is how much work we've done in Oregon already is certainly at OLCC of how products are manufactured. I mean, we have to submit on the cannabis side, we have to submit whether we're making hemp or cannabis products, submit SOPs, how we're doing that. Between the Department of Ag and OLCC, we have to pretty much certify everything from our scales, our commercial kitchens, all of those type of things. So I think part of our problem is we have a lot of this information as far as being certifiable on how we're doing things. We've got a lot of information. I think part of the problem that we have to keep recognizing and going back to is the lack of ability that Metric has to do much more than charge us for tags on the tracking side. I mean, we have to, if we want any kind of inventory, we can't use Metric for inventory, which would be a visible inventory if we could for the state agencies to be able to look at what we have in inventory. There's just right now, we have to use separate, everybody's using a different system. Leafly LeafLink rather is what we end up using because that's also a sales platform. So we have our inventory we can load into there. It's fairly inexpensive for us to be able to keep track of what products we have. But so I think either pushing on Metric to develop some actual usable systems. We still can't even integrate. Most of those systems don't integrate with Metric. So we have to manually load inventory in both platforms. So we're compliant with Metric and compliant, and make it easy for retailers to purchase our products. So I think there's a lot of this data. I mean, we're doing a good job in the direction we're already headed as far as tracking the final products, where they're made. They have to follow the testing standards, all of that. But it seems like we could get a lot more out of whoever's doing our track and trace. Really should mean more than just tracking tags. So I think Metric's part of the problem in this scenario where we are gathering this information. It's how to put it all together so we would be easily certifiable based off of what we already have to follow. Just 2 cents.
Thanks, Brent. Melissa, I see your hand. However, because you're not a task force member, we ask that you email Amanda the information and we'll go that route. Stephen Crowley.
Thanks. This is maybe a stupid question, but I just want to make sure I am understanding. Can anyone kind of clarify how GMP regulations relate to FDA food regulations in general? Because I mean, with the products we're talking about, marijuana products are obviously not allowed in food by the FDA. The FDA has their stance on CBD and THC, even when it's derived from hemp. But it sounds like we're talking about GMP certifications that can be achieved by marijuana and hemp businesses. And so I'm just curious what the interplay is between the Food, Drug, and Cosmetic Act and FDA regulations on food and GMP requirements.
Do you want me to answer this? I can. So these standards are written by accredited certifying bodies, but they are based on FDA regulations. So the FDA exists, it's a government body. You don't get, you don't hand out OLCC certifications, right? That's not a thing. You're a regulator. You guys go in and you regulate. So they're completely separate, but they're based off of the FDA. regulations. So you can get a GMP standard for CFR 111 or 117 or 211, which is pharmaceutical. And our clients can choose whichever one they want to fall to, and then they can adjust when the FDA does put out their own cannabis regulations, or maybe they go, hey, we're going to regulate you as a supplement, or whatever they decide to do. But it gets them set up for that change. And so it is very compliant with FDA food code. When it comes to, the cannabis specific regulations that I was talking about, one company has done a cannabis specific, they are following that 117, and then they've tweaked it to include all of the processes that exist in cannabis facilities, right? It's obviously very, very different than regular food. There's a lot of processes and a lot of food safety issues that exist in cannabis that don't exist in other industries. And so they've decided to take it upon themselves to hire experts and food safety experts and evaluate things and put that in the regulations, which is why I like that. And eventually that's kind of what the FDA will do. And then when the FDA does come out with regulations, once again, they're going to tweak that standard to match it perfectly. And that's kind of what they've been doing. No, the FDA does not regulate cannabis, but eventually they will. And these accredited certifying bodies are seeing that writing on the wall, and also giving consumers a path to know, hey, these guys are actually following standards that align with FDA. And this is a safer product than somebody that isn't GMP certified. I hope that answered your question.
Mr. Crowley, did you have more?
No, I think that covers it. Thanks.
I'm going to suggest we let this sit in and give it time for people to process. It's been a lot of information. I really appreciate it. And Courtney, thanks for the recommendation, and Kim and Phil and everybody that has been here. I think that we need time to process and think on it. Also would give time for the state agencies to kind of look at some of the other state standards that are out there, if it's possible to reach out to contemporaries in other states and kind of see where things are at. I think that would be beneficial. And just as a report from me back to you guys, 2 weeks from now is legislative days. Rep Marsh and I will be given a summary to one of the committees. I'm not sure which one. Then on the 23rd is deadline for individual legislators to have a recommendation. But I believe that we'll have an opportunity for this body to be able to submit things back at a later time through committee and some other stuff. And agency even potential. So we have time that we're not under the same gun as, say, Senator Hansel and I for our own personal. I only have 200 or 300 bills so far. I'm just kidding. Just kidding. But I think we'll try to have a meeting as soon as possible to kind of give time for that to be collected, and give task force members some chance to kind of just process, and so we can come back and answer these questions. What should our recommendations back to the big group be? So I will. Any objections to that? Okay. I think it's too much to just all right, let's decide right this second. We need some more feedback, but I think it's important that we had this information today, and I appreciate that we're delving into everything at such a level. So if there is nothing further, I will adjourn us for today. It's 4:52, and thank you, everybody.
And Representative